Dear listeners, I'm excited to share with you of my interview with Hyacinth, a home health aide of over 20 years' experience in South Florida. Hyacinth shares a riveting story of her experiences taking care of the elderly, their families, as well as highlighting some of the loneliness and depression that they face. Please listen in. So, welcome, Hyacinth.
Thank you very much, Dr. Ganesh.
It's a pleasure to have you on my podcast, and I'm really excited to chat with you about your experience taking care of the elderly. So, before we begin, can you just share with me a little bit about yourself, your age, race, gender, occupation?
Yes. My name is Hyacinth Sampath Ganesh, and I am 69 years old, and I am a proud Trinidadian of East Indian descent.
Okay.
And I have worked over the years many jobs, travel consultant in Margarita, Venezuela. I worked in New York as a child care, specializing in children with disabilities. And I also work in the school system for 4 years as a part-time teacher. And when I moved to Florida, I fell into elderly care.
Oh, wonderful, wonderful. Thank you so much for sharing about your rich experience in caretaking, which leads me to my other question. How long have you been working in elderly care?
It's been 21 years.
So why don't you share with us your experience with that? What was that like?
Well, before I get there, one statement. Before I left New York to reside in Florida, I said I wanted to give of myself when I got older. And it so happened that I never did elder care before. I went back to school for it and in Florida. And I always I gave of myself, but I got paid for it. And that in itself enriched my life. Being surrounded by people in their golden ages. It was a wonderful experience. Listening to their rich, wonderful stories, they wanted somebody to listen to them, and there were hardly people around them to do so. I enjoyed every moment of their stories. Most of my patients came from New York, but they came from Pennsylvania, different parts of the country, really. And I mainly worked in South Florida.
Yeah, so when you say that they wanted people to hear their stories and their experience in life, tell me more about that. What was that like? Why you felt that they wanted someone to listen to them?
Because most of them, the kids were not around. They were in different states, and they didn't have anybody to just listen to what they had to say. Even though I did mostly patients with Alzheimer's, dementia, and they will tell me the same thing 1,000 times for the day, but I had to answer truthfully and repeat the same thing over and over, only because I could not do otherwise. I had to be honest with them. And their stories were the past, the lives they lived. They lived wonderful, diverse lives, really. And I walked away at the end of my time with them with my heart filled. And I fell in love with my patients.
Wow.
It didn't matter what a challenge it was, because some of them were very challenging.
Wow, that's absolutely amazing. So, talk to me about, because part of this podcast is to really explore how families deal with finances around elder care, legal issues, as well as medical care. So, let's start with sort of medical care. What has been your experience as a caregiver with the patients or clients you took care of, getting medical care, accessing medical care? What was that like there in Florida?
Well, most of my patients had long-term care insurance, and that with their Medicare more or less covered a lot of their medical expenses. But the thing about, I will point out to you about long-term care, you pay into it for years, but you only get 3 years back. So at the end of the 3 years, when that stops, a lot of people cannot afford medication again as they used to.
Really?
Yes, it becomes very difficult for a lot of them. And that generation I work with really came out of the Depression era. So their parents went through the Depression. They also. So they saved.
Okay.
And they were able to manage.
Okay.
And without a lot of the kids' help, really.
That's a good point. So you're saying that, and I guess it depends on the type of long-term care plan they may have and how long that may last. So they were pretty much responsible and they were able to get to their appointments, to pay for their medication. What are the other costs that families don't really think about during elder care or even after the passing of their parent?
Well, one of the things initially is the living expenses. The parents do not speak truthfully to their children to let them know how sick they are.
Really?
Yes, they hide it from the kids because they don't want the kids to worry about it. I have experienced this over and over.
Really? Okay.
Yeah.
Uh-huh.
So they will not tell the children. The caregivers now become so close to them that they tell the caregivers everything. And I mean everything.
Wow.
So we become a gateway really between the doctor, the patient and the child. Because we pass on information that's necessary for the children and the doctors.
Okay.
And we still have to adhere to HIPAA rules.
Right, right. Mm-hmm.
Mm-hmm. But also another expense that a lot of people don't think of is now my wonderful patients had saved over the years many things, wonderful, expensive things, beautiful things. The children, on the other hand, a lot of them don't care much for what the parents do have.
When you say things, you mean like furniture and jewelry and
jewelry,
yeah,
and jewelry and expensive paintings.
Okay.
So what happens when the patients go? I was left 5 patients that I was left with getting rid of the things from the apartment. It broke my heart because
Really?
I know some kids had said to me, get rid of everything or you take everything. I don't want anything. I didn't need anything. So I told them, no, I can't. I tried to give them to friends. I tried to give them to neighbors, but I had to get rid of everything. It broke my heart because it meant pictures. One of the hardest things on my last patient was the pictures. Nobody wanted pictures that she had collected over the years.
Really?
And it started me thinking about when my time comes, what's going to happen.
Right.
Yes, we all have to look into this and see what we're going to do with the things that we have accumulated over the years.
Let's talk a little bit more about that. What was some of sort of the relationship dynamics between the parent and their kids from your experience or your point of view? What was that like? Because I know some of them you still have relationships with, right? Some of the kids after their parents passed away. What was sort of the good, bad, ugly experience, the dynamics between the parents and the kids during this whole caregiving experience? Because I'm sure it must be stressful for everyone.
Very much so. But the doctors say to you, my boss said to me, you cannot get emotionally involved. That's a lie. When you're with them, most of their waking moments, you become attached to them and you grow to love them. And it's hard to pull away from that, to separate from that. But I have had the most incredible relationships with a lot of the patients. I will tell you that it was easier in my experience working with children, with patients who had boys, sons.
Really?
Because, yes, the sons was so loving and caring and considerate and treated the parent and myself with a lot of respect. Whereas the girls, they were sometimes, they were not the nicest people to the parent and even no respect to the caregiver. We were supposed to be paid to do our jobs and that was supposed to be it, but it never was that way. I have had the opportunity to meet the greatest people. I have relationships with them till this day. And I have been called an angel a couple of times. I'm not that far from it. But in relation to what I give to my patient, I could not give of myself 100%.
That's actually fascinating you say that, because all the studies and the research that I've done, even I recall a PBS documentary that I saw 20 some odd years ago that looked at different families and family structure and family units and how they took care of an aging parent. And there was one constant denominator, theme, and that was having a daughter or a female figure to take care of the parent. And even to this day, in my discussions and what I'm reading and what I've seen, is mainly the woman or daughter gender to then take care of an elderly parent. But you're saying that the sons have really went above and beyond and treated you very, very differently in a very good way.
Very much so. I recall clearly, this touched my heart. Two sons, she had two sons, and every morning on their way to work, they would speak with her, and on the way home and the way back home in the afternoon, they will speak with her again, twice per day. She had no daughters. She had daughter-in-laws, but they were not as close as. So the boys really stepped up, and they were there with her at the end. And it took everything out of them. We have a great relationship. And one son was not as religious, one was very religious, Orthodox Jew, but it didn't mean anything in the way they thought and their outlook on life. These boys were the greatest ever, and they treated me with respect. And I always say to them, my home is their home. Because when my patients go, usually part of my heart goes with them. It dies also.
Yeah. No, this story is absolutely fascinating. So tell me about some of the sort of the lessons you learn or advice you have for the ones with your poor experience you've had with the family dynamics or the children.
One of the most important thing I believe is respect. I had said to her one day, I was in a group discussion at the gated community where I worked, and I stood up and I said, clients and their family members must respect the caregivers because we give so much to the elderly.
Mm-hmm.
And most of us come from the islands, mm-hmm. where we don't know about parents being in nursing homes.
Right.
We took care of the elderly at home.
Right.
So for us, with this background, we always have a heart and a soft heart and a giving heart for these elderly people. So for me, it was very hard seeing this, accepting it for the society that we live in here in America. And I will say that they have left. In my life, I have taken lessons from each one of them and tried to put it into practice. And even if it was from a religious background, there's some life experiences that they spoke about a lot. But the life experiences for me was the most incredible thing. And I lived a little of it through them.
So what I'm hearing is that you, based on your experience with them, apart from the salary, there was a lot more that you took away from their story, their history, your time with them. So can you tell me about that? What was that like? What are some of the things that you took away that you take with you or you practice today, if you will?
Well, I have learned that over the years that material things accumulated doesn't mean anything at the end of the day, because each one of them, some were very wealthy, some were not, but they came from the same place, wanting the help, needing the help, not really wanting the help. They needed the help really, because some of them are very independent and still believe that they can do so much on their own. But for me, walking away, I can pinpoint different experiences from different patients and what it meant to me. And I remember clearly a gentleman, wonderful gentleman. He said to me one day, Hyacinth, my children, my children's children, and my great-grandchildren shall know my name. And I asked him to explain what that meant. and
Uh-huh.
he was super wealthy.
Uh-huh.
And he said that whatever money that he has will be passed down from generation to generation to generation. And that's when he said, they shall know my name. For me, that stayed with me because I've never heard it being expressed in that way.
Wow.
And
Wow.
I may not have much to give, but my reputation at the end of the day means a lot. One of the things, too, that most of my patients were Jewish,
Uh-huh.
and I don't force religion on them, but I did after a while when they were suffering and in so much pain. And I used to say to them, each one of them I said it to really, is it okay if I pray with you?
Uh-huh.
And at the end, all of them said yes.
Wow.
So it was when I knew it was time, because I knew it was time for them to go, I would hold their hands. And my wish was to be with them when it happened. Hold their hands and we'll pray. And it was a great feeling for me and also for them, because a lot of the children were not there when this happened.
Uh-huh.
And it gave them a sense of comfort. And one of them especially would be screaming at me and saying, hold my hand. She was terrified of dying. Hold
Okay.
my hand. So most of the time I had to hold her hand.
Wow.
Yeah.
Wow. So I want to get back to that, the experience you've had with some of the patients that you dealt with, that all our lives we've been raised to really think and behave, yeah, independently, right? Even kids who are born with impairment, we try our best to raise our children to be as independent as possible. And now you're dealing with a population that cannot, because of sort of natural reasons, aging and growing old, they can't be as independent as they can. So tell me some of those challenges. What was that like for you as an aide to really find that balance, right, between helping them and knowing when to stop or knowing when to intervene, even though they may be stubborn and want to be as independent as they can?
Well, all of them, I will say, they have been through that process of where they're holding on to their independence. But I always give them the option. I would say to them, when you're ready for my help, you can ask me. I'm here for you. Because if I force myself on them and say, do this, let me do this, they lash out sometimes physically. They will want to hit you, or they will not be nice to you and let you know in so many words that, no, I don't need you. But I really become a shadow. And
Okay.
working as a shadow in them. Just in case they want to fall or something happens to them, we right by their side or slightly behind them. We're waiting because we never know what's going to happen. But at the end of the day, most of them finally relented and gave in to us or gave in to me where the independence was concerned, because they realized that they needed me also.
Okay.
And
Okay.
but I will tell you this, I use comedy and I like to laugh a lot. So I use that with my patients all the time to make them laugh, because that is good for the soul. Laughter is good for the soul, and it helped. It helped both ways.
So you're the aide. You maybe have to help them and be their companion during medical appointments. And did you experience any conflicts with that, where you had to really advocate for them or be there to share about the medications they're taking, whether they're taking the medications, whether they're eating? What was that like in terms of your interaction with the providers and the patient?
Well, one of the big things for me that stood out was a lot of the doctors, sad to say, have no patience with the elderly.
Really?
Or yes, so they don't treat them with the level of respect that is they're supposed to get.
Okay.
I have had patients curse out doctors, rightly so, because they're short-handed with them and they sit with them for 2 minutes or 3 minutes and they're out the door. And I have had a patient curse out the doctor and said, get your so-and-so back here and at least give me 5 minutes because you're getting $200 for this visit.
Right.
So I have had that over the years with the doctors not respecting, a lot of them not respecting the patient as they should, because they figure, well, this is end of life and whatever.
Even in a community, even in Florida, where it boasts of the resources and services for the elderly, you've experienced that as well. Okay, that type of discrimination or poor quality care, that I would call it.
Yeah, well, where the medication is concerned, usually when we start the job, one of our jobs is really to administer medication. And I take over the meal preparation because some of them have horrible eating habits.
Uh-huh.
And I prepare nutritious, balanced meals for them, and they enjoy it. I love to cook and they love to eat. So it worked out well that way. And also with the medication, so this was under our control, really. We made sure that they took their medications on time. But they were accessible. They got medication. Even the most expensive ones, some patients were able to buy them, and there was no problem there. I don't think there's much of a problem in South Florida with accessibility to medication and good care, good doctors. You just have to find the best doctor.
So you're saying they do have good doctors. So give me an example of sort of your best experience with the interaction with you and a doctor and a patient.
Well, a lot of times when I go into the offices with them, I go well informed because I have to know my patients through and through.
Right.
So when I go in there, and a lot of the patients don't like to speak the truth about what's really happening. And this is why I step in and they get mad at me. And I say, no, doctor, that's not true.
Okay.
And this is what is happening and that is what is happening. I only do that because it's for their own good.
Right.
But they tend to do that a lot. So I let them know the truth and they go from there. They may yell at me afterwards. I don't care. But I am there for their benefit and to do what's right for them.
Wow.
And, we have had many times where I was yelled at for that. And the doctors understood because they had seen it over and over again. Mm-hmm. And some of the doctors, I'll tell you, would sit and talk to them. And this is what they like. I would say the same thing to my patient 10 times over during the day. But the minute I step into the doctor's office and the doctor will say the same thing, because he's a doctor and the respect that's due to him, they tend to believe what he says.
Got it.
And that's what the aides, I think most of the aides encounter that.
Got it. So that's really interesting to really understand that dynamic between you as the caregiver and the patient families and the doctor. And what was that like for the patient families in that interaction?
I will say 99.9% of the families, I would let them know in the beginning when I start the case that I'm going to be truthful. And I'm not going to lie either way because that wouldn't serve any purpose. So with the children, when I tell them what's happening and the mothers or the fathers deny it, it was difficult initially to get through to the family members and for them to accept the fact that this is what is happening because, like I say, the parents don't want the children to know what's happening. So
wow,
it was, most of us had difficult times talking to the children until we finally get through to them and they realize what's happening. One of the things too that the children don't realize, that the patients still have lives and they want to hold on to the independence that they had before and make decisions. And sometimes they get involved in dating and seeing other people in the community, and the children have a very hard time with that. They can't believe it. But these are lonely people.
Really?
Who crave attention and love and a hug and companionship more than anything.
Wow.
So what I can say to the children out there, call them, call the patients, call your family members, and just say hi. One of the things I noticed too was the children will come on vacation to Florida once a year, and it's a visit to the parents also included in that. Once per year, they'll come, they'll see the parents, take them out to lunch or dinner, and then they go their merry way.
Wow.
And the kids and the parents realize that this is what it is, and it bothered them, but they had to accept it.
So I'm hearing a grave sense of loneliness.
Yes.